Hello, I'm Robert Gerchow. I'm the nurse educator here at MOS Therapy. I graduated from the Johns Hopkins School of Nursing and worked at the Johns Hopkins Hospital, and since then I've worked in a variety of settings. I've worked in home care, psychiatric hospitals, been an interim director of nursing, and for several years I was an instructor at a school of nursing. Most recently, I've spent time in Asia coaching doctors and nurses who want to come to the United States and other English-speaking countries. I've been to over 50 countries, I've lived in Asia, and I've visited all 50 U.S. states. MOS Therapy places nurses from India, the Philippines, the Middle East, Canada, and even the United States. Our process is straightforward and robust. Through our global reach, MOS Therapy helps hospitals, nursing homes, clinics, and other institutions when they have a nursing shortage. My job is to help onboard and support nurses and other professionals that come through our agency to work in the United States. After their initial screening and interview with the directors, they have extensive training sessions with me, maybe 10 or 12 sessions for small groups of nurses, and if necessary, individually. We go around the virtual rooms and get them to introduce themselves, teach them to be assertive and engaging in their speech. Some of them have mostly worked in their own countries, others in places such as the Middle East, where nursing practice is similar to that in the United States. We talk about how you manage time on a shift with multiple patients, how you relate to doctors, patients, other staff, and people in the community. We explain that American culture, unlike some of their countries, is more collaborative. Whether you're talking to the doctor, the patient who may be from a different social class as yourself, or anyone else, that we try to be friendly and engaging at all times. One nurse was having trouble working with her patients relating to elderly Americans, and I explained, just pull up close, make eye contact, because you can understand his accent and he can understand yours better that way. We need to be professional, kind of act like they're your friend. Engage the patient and get the patient to buy into whatever you're doing, whether it's taking their medicines, go to physical therapy, getting an operation, or it's time to go home today. I explain to them that their language and culture, accent, manner of carrying themselves is not necessarily a bad thing. It can be your brand, and people will remember you, will like you if you handle things that way. If a nurse has a problem, I sit down with the nurse, their nurse manager, and our directors here at MOS individually and separately to try to resolve the problem. Sometimes people's expectations are different than what they see when we get here to the United States. They need to drive cars, usually on the different side of the road than where they're from. In many of these countries, people drive on the left and sit on the right, opposite of what we do in the United States. Usually our traffic is much more orderly than where they're from, and they like that. I talk to them about the American healthcare system, where patients come from, how most people are admitted through emergency rooms. We don't have outpatient departments as they do in some countries. That insurance is always an issue and often determines the level of care and how long they can stay. This may be new to many of them. I've been working with MOS for around 2 years, and they're good people. And I know of a number of such agencies, and I would say they are the best that I have seen. They're ethical and honest with their clients and with their nurses, and available in every way to help. I wish you well on your journey with MOS, and hope to meet with you soon with one of our nurses. Thank you. This is Robert.